Hello, my name is Richard, and I believe I have a solution to improve our nation's healthcare system and also how to fund that system. One of the former governors for the state of Utah compared our healthcare system like the Cinderella story. So the Cinderella's at the ball, it's 11:40 at night, she's danced and she's not caring about midnight. But when that clock strikes 12, her dress is going to rags and her carriage is turning into a pumpkin and everybody's running. The same thing with their healthcare system. If her healthcare system goes bankrupt and there's no money to pay the facilities, the facilities aren't going to be able to pay the healthcare providers, and the healthcare providers are going to be running, and there's going to be no system. We live in a world of capitalism. I don't have any problem with capitalism, but in regards to food, the majority of capitalists are making money on unhealthy foods. It's actually cheaper for us as Americans to eat unhealthy as opposed to healthy. I can go into a grocery store and buy a box of macaroni and cheese and feed my family as opposed to buying fruits and vegetables, which would be much more expensive. So what I'm suggesting is this, is that we start taxing all unhealthy foods. Anything from soda to candy to donuts to fast food, anything that's obviously unhealthy. We tax tobacco and liquor. Why do we do that? Because we're trying to deter people from drinking and smoking. So if we tax unhealthy foods, we could deter people from eating unhealthy food, which is actually creating a majority of our medical costs with people living these and having these unhealthy diets and living these sedentary lifestyles are creating unhealthy people, which are absorbing the majority of our medical cost. If you look at an auto insurance company, they're going to target people. They target the teenager. They target the person that has multiple accidents. Why? Because they're more at risk and they cost the system much more money. The same thing with this. If we're going to tax somebody, why not target the people that are partaking more of the system than others? I believe that we should be providing incentives to capitalists to be able to have the opportunity to make money in healthy food. I'd like to go into a grocery store and see that white bread more expensive than the whole grain bread. If somebody notices that the whole grain bread is 50 cents cheaper per loaf, they're going to be more inclined to buy that loaf of bread just based on economic reasons and realize that actually eating healthy is tasty as well. I've been in rehabilitation for the past 15 years. The majority of my patients have had strokes, cardiac complications, just basic general deconditioning from medical complications. Um, there's something consistent that I hear from my patients, that a lot of them were very unaware of the lifestyle that they were living was going to be putting them in a situation where they were in a hospital receiving therapy. Um, I got a healthcare degree and I didn't really learn about diet and exercise. The majority of my education I got was from being around people that had good diets and that were exercising. What I'm suggesting is this, is that we have an allotted tax write-off for those that go out and purchase memberships at some sort of gym or yoga studio. The majority of the education that I've ever received on diet and exercise wasn't from a degree in the healthcare field, but it was about me being around people that had good diets and were exercising. The same thing with this. We need to get people out. We need to get them communicating with others, and it's really truly about a lifestyle. I also believe that if someone's going to get a membership at a gym, that gym would print something off at the end of the year to be able to show proof of attendance in order for somebody to get that tax write-off. You look at what's happening to the United States when it comes to obesity. Obesity's doubled in adults this past 20 years and it's tripled in children and adolescents. You look at what happens to somebody that starts to gain weight over time. If you were to gain only 0.017 pounds a day, on 6 months you'd gain 3 pounds, a year you'd gain 6 pounds, and in 10 years you'd gain 60 pounds. It creeps up on us very slowly, and it's very difficult to measure that on a day-to-day. In the United States, a lot of us live the path of least resistance. We eat what we want, we don't exercise, but that comes with the consequence. And that consequence is poor health and increased medical costs for all to pay. We even have systems where people can apply for disability. They can get food stamps. They start partaking in these social systems where our tax dollars start to pay them. So I'm suggesting that if someone's going to use these systems, that they use them appropriately. If someone's going to use food stamps, that we should be directing them, much like the social program of WIC, that they go and they buy healthy foods. That they shouldn't be able to buy soda pop and donuts and whatever they want from the grocery store on our tax dollar, but that they should be, if they're going to be using our money, that they should be using it towards healthy foods. If they want to buy unhealthy foods, well, they can use their own money. I wrote a letter to the editor, the Salt Lake Tribune, and it got quite a bit of attention and got a lot of positive feedback and a lot of negative. Some of the negative feedback I'd like to address, and that is taxes. The government is always taxing us. We don't want any more government control. We don't need a tax. But the reality of the situation, if we're going to be funding social programs, or when we fund our public schools, or we fund our police departments, or our fire departments, we need a tax. And so what better way to target the right people for the tax? There's lots of different classes. Should we be taxing the rich, the middle class, the lower income families? I don't think we should be doing that. I think we should be directing our tax towards those that are voluntarily choosing to live unhealthy lifestyles by their eating habits and their sedentary lifestyles by not exercising. I think that's more of an appropriate tax. I've also heard that we live in a free country. I'm free to do whatever I want. No one's going to tell me what to do. Those people that are being taxed on alcohol and tobacco, I'm sure they weren't very happy about that either when they were being taxed. The same thing with this unhealthy food. People aren't happy about it. But you can still smoke, you can still drink, and you can still eat unhealthy food. It's just going to cost you more money, because when you do those things, you'll need to use the healthcare system more, and it costs more for all of us to pay. And on the subject of freedom, if someone's racking up medical bills, is it really fair for someone that does live a healthy lifestyle to be paying for those bills? I don't think so. I'm not trying to make a big political move here. I'm neither Democrat or Republican. I'm actually registered as an independent. What's frustrating to me is I'm seeing these two political parties that are giving so much resistance to each other that it's making it very difficult for us as Americans to get things done. We have a system that's spiraling down. And what my goal is to get this information out there, to get people talking about this, start talking to local politicians, and start talking to whoever we can to be able to fund the system. Because if we don't, we won't have a system we can all use. Peace out.